Breastfeeding is one of the best practices that you can do as a mom, and it is the best gift that you can give to your baby at that time. And besides breast milk having the good nutrients and proper nutrients for our babies at that time, it also has very essential health benefits that help see our children develop well throughout their life. And I will welcome you today so that we can be able to dive into some of the problems that have made breastfeeding a problem to us, that we cannot withstand breastfeeding our babies for all the 6 months exclusively, or even fail to breastfeed them for even the 4 months that some of us have resorted to. So kindly join me and let us get ourselves informed and enlightened. Having said that breast milk is the best feed for your baby, this necessitates us to breastfeed our babies because we know the benefits of breastfeeding. However, when we get problems that are related to breastfeeding, then breastfeeding becomes a whole nightmare, and we cannot actually carry on to breastfeed our babies for that long, that is prescribed 6 months. And some of us actually drop off even from the first day because of the problems associated with breastfeeding. Poor supply of milk or inadequate milk supply is one of the problems that mothers have voiced out. Now, naturally, when a mother delivers, milk is supposed to flow naturally to the baby, of course, after attaching them or giving them the breast at delivery. And one of the causes that could lead to inadequate breast milk, since this is an issue to us, some of us do not get the chance of having a consistent flow from the very beginning. One of the causes could be our mental stability. How stable is your mind? How have you prepared yourself to breastfeed your baby? Because it is not only about the physical, you having the breasts and the baby being there. It also dawns to how stable you are mentally for you to be able to produce milk in a very adequate way. So try and check that you're not having stress, you are mentally stable, you do not regret having your baby. This could lead to you wanting to know whether you are having psychosis, maternal psychosis. So make sure that you are stable, and if you are not, it is easier to consult your doctors and find that you get help. And definitely you will have milk come through when you have a stable mind. The other reason could be glandular tissues. Of course, this one you will have to visit your doctors for them to be able to rule it out and be able to give you a way forward on how to deal with it. Then the other issue could be you are not breastfeeding your baby. You are not attaching them to the breast. Now, mothers should know that whenever we give our children the breasts to suck, there is a hormone that is being released in our bodies, and that hormone is specifically produced to be able to ease your lactation period, and that hormone is prolactin. Prolactin, of course, coupled up with oxytocin, that is why you are usually given the baby to breastfeed in the first hour of your delivery, so that you can have the oxytocin work on the uterus and also facilitate in the milk production. So try as much as possible to breastfeed your baby, even when you know that you do not have enough milk, when you feel like there is nothing they are getting. Just keep on latching them on that breast so that they can be, it will come with time. Be patient and do so, and in the end you will definitely see the results. They will have enough milk that will take them all through. Now, if that is still not working for you, then move to this other simple home remedy that is accessible to almost every mother, and that one is a warm compress. Get warm water or hot water, put it in a basin, and get a towel and use it to compress your head right away from this part of your head, and then to your neck, and then to your shoulders, and then to your chest. This will help in facilitating blood flow, and of course when you have a good blood flow, then you are assured of good milk production. So if you are in position to get that warm compress and you have delivered maybe yesterday, today, and you're not having enough milk, try it. In most cases, when we do that, we usually actually get overwhelmed by the milk production flow that we are having. So try that if you are having inadequate supply of milk. I did that personally, and it really came in handy for me, for my baby. Just like I have said, when we do this warm compress on ourselves, we might find ourselves getting more milk than actually the baby can be able to take. I have been in that position where the milk is leaking everywhere and you do not have anything you can do at that moment. It is not a bad thing, but it raises concerns because you cannot wear anything nice and move, you know. That is where you get to helping yourself. Get yourself breast pads if you can. To those mothers like me who are from areas that you are not in position to get those fancy breast pads, then you get clean towels, clean face towels that you can be able to fold and put on your nipple or on your breast and wear a brazier in it. Try as much as possible to keep yourself dry. Even when you are breastfeeding, you want to look good. So do that and you will have solved the leaking problem of your breasts. When this milk gets too much and it is leaking, sometimes it could actually graduate into breast engorgement. Now, this is one of the nightmares a mother can ever get when they are breastfeeding. It is painful, the breasts get tense, some of them get reddish, and then the others, of course, when they get reddish, then you have to worry because you might be graduating from breast engorgement to mastitis, which is inflammation of our breasts. So do not wait to get to that point. And one of the things that you can be able to tell whether your breasts are engorged is, one, they become bigger in size, and then they also become tender to touch. You cannot be able, you do not want anything to touch them. And at this moment, they are hot. Yeah? They are hot because of the milk that is in them. Some of them even become so hard, yeah, because of the milk that has stored in them. So try to become in this situation. I know it is hard because you are in pain, but try to become. One of the things that you can do to ease yourself of breast engorgement is, one, the warm compress, like we used previously on breast leakage. Use a warm compress. It could help in breaking all that fat that is gathering in your breast and causing the swelling and the pain. So use a warm compress on yourself. You could also heat up a towel and just put it on inside your bra and wear it. And the other thing that is miraculous with breast engorgement, one of the recipes in my previous video I said was a cabbage leaf. A cabbage leaf, you just get it and pound it. Do not like slice it, just leave it whole, but pound it. And then when you've pounded it, you put it in your brazier and wear it along with the brazier. This will not necessarily deal away with the milk that is in your breast at that point, but it will help reduce the pain. It works miracles. So try using a cabbage leaf. That is for the natural remedy. The other thing you can do as a mother if you have breast engorgement is to express this milk, because there is excess milk in your breast and your baby won't definitely finish it. So express it and store it for them to take at a different period. And also breastfeed these babies more frequently. Let them feed. The milk is there. Let it not kill you. You can help them feed. Of course, they will not be that interested that they will take out all the milk, especially when they are very young, but try, give them the feed, and you will have yourself sorted. The other problem that mothers face is inverted nipples. Now, inverted nipples is when our nipples are flat, they're indrawn. Of course, for a normal healthy breast, some are born with inverted nipples. They are not like out and pointed. Whereas an inverted nipple could, if you get it later on in your life, it could be a symptom or sign to a disease, most especially breast cancer. So try as much as possible to see that you get concerned when you get an inverted nipple later on in life. Now, coming to an inverted nipple to a person who has been like that throughout their girl's life and now progressed to motherhood, you have inverted nipples. What do you do with them? Of course, inverted nipples make breastfeeding very hard for a mother. Why? Because the baby cannot latch on your breast, because they definitely can't differentiate the areolar part and the nipple. So latching becomes very hard for them. So what do you do when you have an inverted nipple? One of the things that you can do is massage your breast with your fingers, especially the nipples, and try to make them protrude. Of course, that I find it very uncomfortable sometimes, because in most cases with inverted nipples you are likely to have engorgement coming along with them, because if you have an adequate milk supply or milk flow. But in case you have delivered today and you realize you have inverted nipples, your baby is not attaching well, try as much as possible to massage those nipples out so that they can be protruded out. The other one is use a suction device. Now, some of the places where we live, you can be able to access a suction device. This is to be able to create a vacuum between your nipple and your areolar area so that the nipple protrudes out. But if you cannot, then I have a hack for you that I'm going to demonstrate. You use a syringe. So I'm going to demonstrate that right here. All right. I have an inflated glove to act as my breast. Of course, your breast doesn't have all these, I'm calling these nipples, so it doesn't have all this. I'm going to use just one of them. So an inverted nipple is not protruding like this one we have here. I think I should use this one here. Our inverted nipple is not protruding like this one I have here. So an inverted nipple looks like that. I don't know whether you can see it. It is basically indrawn. So you have like a flat breast. It doesn't have a nipple protruding out. So what do you do when you have such a nipple? You need a syringe. Quite smaller than this one. This is a 20 ml syringe, but if you have a 5 ml syringe, depending on how big your nipple is or how big the nipple area is, then a 5 ml syringe should be fine with most of us. So I'm going to use this syringe, and this is how I'll use it. I need a knife to cut out part of this tip that usually holds our syringe. So I will make a mark and be able to cut it out. So here is my syringe. Previously it was like that. So I've taken off the tip or the top part, and I'm going to go ahead and pull out this piston from there. And then I have the syringe this side, the bulb of the syringe, and then the piston here. So I'll use this. I hope all of you can be able to see. This other side is what you use to now create a suction on your nipple or on your breast. So you take this other part, the piston, and push it through this other part where you had the other part being cut off. So like that, you have a piston or a suction device. This is going to be our suction device. Most mothers will afford this and they are able to get it. So this is what you will now use to be able to create a vacuum on those nipples. And when you are going to do this, you can try and apply oil on your nipples so that you do not cause damage to them in the process. But if you use this end, like I've showed you, do not use this other end where you have cut, because it will definitely damage your breast or your nipples. But now I'm going to take this and put it on my inverted nipple. Of course, this would have been easier on a breast, but we will survive. So this is what I do. I put my suction machine there, handmade, and then I pull with a syringe. Now remember, this is acting as our breast, so I'm pulling it, and guys, that is how your nipple will come into the syringe. I hope you can see that that was an inverted nipple and it is now in the syringe. It will definitely come into the syringe. You will be able to see it. And you do this 4 times a day, in the morning, in the afternoon, in the evening, whichever time is comfortable for you, just do it. Anytime that you feel your nipple is ready to go through the process. Yeah. And this will help within 3 days, a week, your nipples will not be inverted anymore and you will not need to use this suction. So that is a hack for you mothers with inverted nipples and you are breastfeeding. The other thing that mothers usually complain about while breastfeeding and raises concerns is cracked nipples. Now, a cracked nipple is very painful, and a cracked nipple is not a good thing. It's not a good thing for a breastfeeding mother. Some of the causes, and majorly the cause of cracked nipple, is poor attachment during breastfeeding. When you attach your baby to the breast poorly or in a poor fashion, then be sure to get a cracked nipple. Why? Because they are not having the whole of the nipple and the areola in the mouth. They are just having just the tip of the nipple, and obviously with their little small gums they are able to bite on you. So you can be, and of course because of that sucking reflex, it is strong. Their mouth, the flow and the tongue, they create that kind of friction. So if you do not take keen notice, you will have a cracked nipple in the end. So try as much as possible, one, to attach your baby well. Let them latch to the whole areola. The biggest part of the areola should be in their mouth, so that the nipple is just safe in there, in the vacuum of the mouth created. Correct breastfeeding attachment positioning. Those are the things that you need to check. And then also, to some of us, we need to check our soaps and our creams. Yes, our soaps and our creams, we need to check them out. They could be the ones causing the soreness, and of which will lead eventually to cracked nipples. So one of the things that you can do when you have a cracked nipple is, one, apply Vaseline. Apply Vaseline. When you apply Vaseline to the nipple, you create a Vaseline mask. It will cause the wound to heal very easily. Or for us that can afford the creams, the nipple creams, get a nipple cream for yourself and be able to apply it there so that you do not have a cracked nipple in the end. A cracked nipple could lead you to get mastitis, which is inflammation of our breasts. So do as much care to your nipple so that you do not get that to that point where you have now mastitis. And then shea butter is also one of the oils, the natural oils that you can be able to get, whether it's extra virgin, olive oil, those organic oils, they are good. You can use them, apply them on your nipples. Definitely you will have your problem solved of cracked nipples. Thank you for watching up to this time, and if you found this content very important to you, kindly consider subscribing and also sharing to all mothers so that they can be informed and make parenthood a better thing for others. See you in the next video. Stay safe and God bless you.